Good morning, wherever you're watching me from. I am Dr. Joy Naliaka Masinde, a medical doctor at Ubuntu. Today being World Cerebral Palsy Day, we would like to create awareness as concerns cerebral palsy, now that a vast majority of the patients that we serve at our center have cerebral palsy. Cerebral palsy is a neurological disorder that is non-progressive and it affects movement and posture, which in turn limits the ability for normal daily living. The current statistics as from CDC, 17 million people are living with cerebral palsy. We currently don't have any current Kenyan data as concerns that, but it's stipulated that 2 to 3 children out of 100 have cerebral palsy. For the causes of cerebral palsy, the baby can be affected antenatally, that is before they are born, during delivery, and early postnatally. So for the risk factors, there are maternal risk factors, that is malnutrition, which is a big burden in sub-Saharan Africa, maternal conditions such as diabetes and hypertension, and polyhydramnios, which basically means excess amniotic fluid. During labor and delivery, there is a premature labor, there is prolonged rupture of membranes, premature rupture of membranes, abnormal presentation, and asphyxia from whichever cause. For the baby after delivery, infections such as sepsis, meningitis, periventricular hemorrhage, and intraventricular hemorrhages. For the clinical presentation, these babies mostly present with developmental delay. So at 3 months, you'll notice the baby cannot be able to hold the head. At around 8 months, the baby is not able to sit down without support. They have delay in crawling, and whenever they crawl, they have a lag of one leg behind. They might be rigid. They might be floppy and have a hypotonic trunk. They may have fisting of the thumbs and fisting of the hand. They might have a rigidity of all their extremities or one or more extremities involved. They have feeding problems. They have visual impairment and hearing impairment. And on most times, it doesn't only affect the motor functions, it also affects cognitive function, behavioral function, and also perception. For the diagnosis is mostly made after age of 2 years, and it has to be non-progressive because there are other causes of neurodevelopmental disorders. For the classification of cerebral palsy, we have a broad classification, that is spastic cerebral palsy, meaning that there's increased tone in the extremities. It can affect the forelimbs, what is called quadriplegic cerebral palsy. It can affect one arm and one leg, that is hemiplegic cerebral palsy, and most times the arms are affected more than the legs. It can affect the lower extremities, that is diplegic cerebral palsy, and it can be triplegic. That means it affects the lower extremities plus one of the arms. Cerebral palsy can also be athetoid cerebral palsy stroke dyskinetic cerebral palsy, where the child has involuntary movements after they've initiated a voluntary movement. That's, let's say, feeding. Number 3, we can have ataxic cerebral palsy, where they have kind of imbalance when they are walking and a wide-based gait. It can also be classified based on the gross motor function, which has various levels, and it can also be classified based on the level of activity of a child. Most of the times, we don't require imaging for us to say this child has cerebral palsy. It's mostly based on the physical findings and the history of a patient. Though CT scans and MRIs can be able to give us much more detail on which area of the brain is affected. As concerns the management of cerebral palsy, it has a multidisciplinary approach. That is, we need various people to help us in managing these patients. Number one, we need a neurodevelopmental pediatrician, we need a neurologist, We need orthopedic surgeons, we need physiotherapist, we need occupational therapist, we require speech therapist, and we require special education. As I had clearly mentioned at the start, it not only affects the motor function, but it also affects the cognitive function, the behavioral function, and the perception and intellectual function of a child. So there are associated comorbidities. Number one, we have epilepsy, we have feeding problems, we have hearing impairment, we have visual impairment, we have risk of joint dislocation, we have constipation, and we have urological complications. Early intervention is very important for these children, so that we can be able to ensure they have joint mobility and they're able to have activities of daily living. So this year, as we mark the World Cerebral Palsy Day, with the theme being Million of Reasons Why, let us remember these children are special, their parents need a lot of support, and let us work together as we aim to give them a normal kind of life. Thank you.